Are we going too slow? Is it okay? Because Naina all the way from central India says, sir is not rushing today because we have the cream of Andhra Pradesh of Guntur Medical College with us. We really want to see how well they're prepared at the end of the year. So, we'll try to run fast. How many of you are hungry? I know. We'll try to run fast. But do you want me to finish all 200? Yes or no? How many want to say no? Yes? We'll run fast. You also answer fast. What is preserved or not preserved? Quick, you are wrong, right answer. Beautiful. External jugular vein. So you must know radical is ipsilateral cervical lymph node groups, whereas modified radical may SAN, IJV and sternocleidomastoid are the ones which are preserved. Now doctor, outbreaks of leptospirosis. Beautiful. Floods. Loss of tension in vocal cord. Where do you have? External branch of the superior laryngeal nerve. Absolutely right. Now, melanocytes migrate. That's how you have non-migration defects like Hirschsprung's disease, which is very sensitive to heat. Beautiful. All failures are cold chain failures in OPD. Mycetoma which occurs in foot. Actually, examiner said eumycetoma. No, he said pseudomycetoma in the key. But eumycetoma looks reasonable for me. That's good. So, original key now which is under correction. 2-3 answers were modifiable in the original key of the examiner. Now, doctor, we make lot of anastomosis during Whipples. So, which is known to leak very frequently? Pancreatico jejunous leakage. When do you want to do histenosalpingography? Confident answer. In the first half of menstrual cycle following the bleeding. Classical time for doing. Similarly, when will you do endometrial biopsy? Timing of different procedures in gynecology. 4 timings are important. A lot of times we reviewed in our mock test. In operated case of cholecystostomy, histopathological report says gallbladder cancer is only restricted to the mucosa. What do you want to do? Only you need to do cholecystectomy and observation follow-up. No need of disturbing the liver or anything. Today only you should review gallbladder carcinoma in surgery, top 50 topics. Treatment protocol is important. What will you do depending on the stage of the gallbladder cancer? Straight question will come once more in the state entrance. Isliye. Now, for the bleeding esophageal varices, what is the initial treatment of choice? Banding and sclerotherapy. Foramen of Lakh. It is basically posterolateral. Morgagni is anterior, AM is morning, PM is evening. Now, commonest malignancy in thyroid gland, which is affected by ischemic colitis, splenic flexure, which is the watershed zone. Clavicle, cleidocranial dysplasia. Young's prostatectomy is what? Perineal. Once upon a time there lived a young. 19 1905. As a medical student, I used to have a phobia. Whenever you walk to the ward or classical medical colleges, you will have the list of all previous principals, previous professors. Looking at their faces, they used to not keep smiling face, they used to keep tough face. I used to be afraid I am not worth to stand before the eminence of such great people. Special type of psychiatric phobia actually. So, Young is also a serious professor. So, even now the perennial approach is a popular approach. Then Millen first described radical retropubic prostatectomy. So that can be the MCQ in the next exam. What is Millen's approach? Right? Now, what are the advantages of the RPP on RRP? Still, if you have energy, you can read it. Now, doctor, where do you use electron radiotherapy? Electron beam radiotherapy. What is the guesswork? Brain tumors. You want to say? Any other? Retinal malignancies. और कुछ बोलो, doctor. Come on. You may be right also. Retinal may be right. Brain may be right. I am just asking opinion poll of the remaining people. Anupama's Aam Aadmi answer is prostate cancer. I tell you no. Some questions can't be guessed by anybody. So, electron beam radiation for cutaneous lymphomas and a lot of skin tumors. What is except about signs of thyroid deficiency? Easy question. Bradycardia will be there. Burns may, how much ml? Definitely, Parkland formula, child versus adult, how to calculate, how much to be given in the first 8 hours. Sharp, sharp, ready for the exam. Pseudo dementia, when will you get, doctor? That's what Lord Krishna said. Krodad bhavati. What? From anger comes, from affinity comes anger, anger comes memory loss, and after having memory loss, the man loses his existence. So, last moment before exam, don't be depressed because depression brings memory loss. But why depression is there? Because there is memory loss. So, that is a circadian chain, doctor. Don't worry. If you forget, forget. At least think, oh, tomorrow if I divorce, I'll have that strength to forget and remarry somebody. So, forgetfulness is the God's boon. So, don't worry that you will forget. It is a costume of his figs. Barrett's, painless glass hematuria, beautiful renal cell carcinoma. All these are the categories of learning disorders as per DSM classification, except mathematics disorder. और एक guess मारो. Disorder of written expression. ये मेरा प्रेम पत्र पढ़कर तो नाराज न होना. If you don't know how to write a prem patra, do you think it is not a learning disorder? और एक कोशिश करो. Language disorder. Right. According to the DSM, not according to you. So, doctor, reading disorder, written expression disorder, math disability, non-definable. That's how the learning disorders are divided. Most common cause of small intestine obstruction, doctor? Postoperative adhesions. Pouch of Douglas abscess, what do you want to do? You want to do posterior colpotomy and try to drain it out, is what you need to do. Then traumatic brain injury ki wajah se, what is the commonest psychiatric sequelae? Mood disorder? Anybody answered anxiety disorder? Come on, I told no, you don't need to read psychiatry to answer psychiatry in MD entrance. If you read altogether, there is a risk of wrong answers. Mood disorder. Depression is most common sequelae, in fact. Which will not contribute to enterobiliary fistula. Basically, gastric ulcers don't. Then, most common type of breast cancer? Just examiner want to give some solacing massage. In a child who has ADHD, who joined medical college first year, what is the first choice of medicine? Other than firing the professor. What's your answer? Huh? Mithai? Beautiful doctor. You are ready with ADHD also means you are too good in psychiatry. Autism भी पढ़ लिया ना? Autism, ADHD ये सब के बिना पेपर नहीं रहेगा. Personality disorders, delusional disorders, schizophrenia, highest topic, not more than 15 topics. It is reading beyond 15 topics in the list given by me is not good for your mental health. Huh? So that's very important. Mentriers. Basically, mentriers is a precancerous condition. It is not benign. Alpha fetoprotein. Pathology में fourth high yield topic is tumor markers. Yolk sac. Then delusion is an abnormal variant of which part of our psyche? Basically, problem is with thinking. Carcinoma colon. Huh? Pollen syndrome. It is something to do with too much, no? Now, Ranson's, this is a beautiful question, doctor. इसको बोलते हैं ankle fixing question. जल्दी बोलो कि नहीं देख के आपका सच्चाई का आंसर बोलो. WBC कौन था? ल्यूकोसाइटोसिस ओपन करते ही दिखाई देगा. ये ST और LT? Beautiful. ये ST is included. Very difficult, doctor. Ranson's पूरा पढ़ के, Glasgow भी पढ़ के, Apache भी पढ़ के, फिर भी आंसर रॉन्ग किए तो गम पार्टी करने का मौका है. You need to celebrate sadness party. So, doctor, at admission within 48 hours, you need to be quite sure. Now, when a solvent is moving in one direction, it tends to drag along with that some other molecules of solute. When a handsome boy is moving in one direction, it tends to drag all other molecules who are studying in the reading room in the same direction. What is that called? Solvent drag. You need to be quite sure. So, Donan's effect and solvent drag. Two more or less similar questions had been asked in the same exam. First, right posterior intercostal vein, where will it drain, doctor? The posterior intercostal veins may exception it is. What is your answer? Right brachiocephalic vein is the first posterior intercostal vein. Second and third posterior intercostal vein will drain into superior intercostal vein. Remaining posterior intercostal veins drain into azygous vein. Straight same question will come in tomorrow's entrance, opening question. You know my address. Gluteus maximus is innervated by? By chance anybody thought superior? Free coaching mil jayega. So from 10th onwards you have a wonderful anatomy lecture. Totally 1000 questions we will review. Every day 200 MCQs only. Now all MCQ based review. Last year we did all theory based review of topics. Once more we will do new MCQ based review. You will have a teacher every day. We have a daily test. 50 MCQs we will give, answer them. We will have a debate and discussion on that, and another 150 questions of a particular chapter we will have a review. Like that, in 10 days you will finish anatomy. Please do come. You are our guests to review the anatomy. If you can't come, take a free online account. We will give you an access for the anatomy classes to be attended. So, in sitting in your home, I mean, Inferior gluteal nerve. Total plasma osmolarity, what is it due to? Basically sodium and chloride. Sodium and chloride. Septal, any papillary muscle for that matter is there in? Right ventricle or left ventricle? Left or right? No, doctor. Right ventricle. Papillary muscles are located in the ventricles. They attach to the cusps of the AV valves, and you have the septal papillary muscle in the right ventricle actually. Portocaval anastomosis, where is it located? Bare area. You must know all the 5 locations where you have esophageal branch of left gastric vein with esophageal vein, suprarectal vein with middle and inferior rectal vein. Examiner's favorite question is middle rectal vein is branch of what, inferior rectal vein is branch of what, they are the branches of the different things. You must be sure. When the surrounding temperature is great than the skin temperature, how is the heat loss? Huh? Convention. To whom do you want to transmit it? By touching. Evaporation, doctor, evaporation. Inversion, eversion, where do they occur? Subtalar joint is also called calcaneal joint is a place. Then archicerebellum, paleocerebellum, neocerebellum. You need to be quite sure on cerebellum in physiology. Top 50 topics. You have cerebellum as a some 15th or 16th topic. Any exam you will have it. What is your answer? All deep nuclei, everything you must say. What is the answer? Wrong answer bolo, jara hum bhi khush ho jaye. Globose you thought, eh? Oh doctor, fastigial. Basically, archicerebellum is important for our equilibrium. Equilibrium. And it is the oldest portion. Floccular nodular lobe and fastigial nuclei are the 2 buzzwords. And in neocerebellum, the remaining part of it and dentate nuclei are very important component. What is the least pungent inhalation agent? De bolo. See, kabhi propofol dekha kya? Few of you might have seen. It's called milk of amnesia. Huh? So it is a sevoflurane which is considered to be the least pungent. Proximal part of tubotympanic recess, from where is it? What is it giving rise to? Huh? Pharyngotympanic tube. Common peroneal nerve, what will it lead to? You have deep and superficial peroneal, both of them. So you have both sensory and also the motor loss. Then flexion, adduction, internal rotation. Classically, posterior dislocation of the hip. One of the traditional questions since times immemorial. Aplastic crisis, sequestration crisis, when will they occur? In which subset of population? Spot answer. Classically, where else do we know about them? Then anterior cruciate ligament, how will you test? Huh? Basically we do Lachman's test is what need to be remembered. You have to glide. Excessive gliding, AP direction is an important indication. So I think you all enjoyed the wonderful orthopedics classes from Dakshinamurthy sir from Guntur, who was kind enough to deliver a lecture. Once more he is going to teach in the next batch. All the way students from Jammu to Kanyakumari were the audience, and they really appreciated the clarity with which they understood orthopedics. So this year we are going to have around 70 different medical teachers who are excellent in different parts of country coming onto a common platform of online session. But I will be always there on Sunday because the only guy who knows forensic, how to cut a dead body, to Mauritius simile with maneuver in obstetrics. There is an inborn error of metabolism actually. So it's not possible for other consultants, but they are very good in their own subject. So we are trying to organize a lot of online teachers. You can tell your juniors to come for our online session, which is available in the learning centers across India. Now, hematogenous osteomyelitis, metaphysis, beautiful. Sacroiliac involvement, back pain in a middle-aged female, ankylosing spondylitis, housemaid knee, once more, double repeat, prepatellar, then intercapsular fracture neck of femur. First of all, intracapsular fracture neck of femur is a old age problem or young age problem? Unless there is a road traffic accident with a significant trauma, intracapsular fracture doesn't occur. Agar intracapsular fracture हुए तो what is the problem? Basically they have got the issue with the osteonecrosis and non-union. So that is the reason open reduction and internal fixation using the Water-Jones exposure and using the cancellous screws is what you need to ultimately remember. After surgery, there is an inability to extend the fingers and thumb. Extension is the function of posterior nerve, which is a branch of radial. That's good. Then doctor, these are all electron carriers. I think easiest question about electron transport chain. We all prepared insanely about rotomycin, what will it do? Ubiquinone inhibitors are what? I never liked the topic called electron transport chain. Very, very boring. Antimycin D, what will it do? Etc. But examiner is easy going. So it is not hemoglobin. That too easy. If you think hemoglobin is a part of electron transport chain B, agar samjhe to, you will be checked what relation you have with the university. So the best visibility of structures of radiograph, basically barium. In fact, to know the mucosal details of the GIT, barium film is the best thing. But this may what is except? Once more, top 50 topics in orthopedics, Perthis is there. What is the answer? It is not bilateral, it is a typical unilateral. Another very common question of the examiner, transient synovitis of hip. एक viral fever हुआ, बच्चा थोड़ा sneezing किया, बाद में limp करना शुरू कर दिया. What do you want to do? You want to do any super duper surgery? Common topic. You need to be sure. Then doctor, hemoglobin आसानी से, when will oxygen is released from hemoglobin? Oxygen is released from hemoglobin. If 2,3-DPG binds, oxygen doesn't bind. If oxygen binds, 2,3-DPG has to leave. Pati, Patni or O. O is what? Oxygen. Pati, Patni are 2,3-DPG and hemoglobin. So if this is there, that will not be there. Osteochondromas, where you don't see. Tough question. You thought it as? Diaphyseal achalasia. You thought Oh, doctor. There's a difference between osteochondroma and enchondroma. Are they both same? Olier's is what? Olier's is a non-hereditary intraosseous enchondromas. Multiple. Is called Olier's. Okay, doc. Now, what is not used in osteoporosis? We don't use dexamethasone. Dexamethasone in fact is a predisposing factor for, that's right. Now doctor, cobblestone. Easy question. Then what is not a source of gluconeogenesis? Easy question. Alanine. Doctor, I am not asking what are ketogenic, what are glucogenic, even I am not asking even that. Palmitate is a lipid. If you know that, you know the answer. Right? Ketogenic होता है एस्टाइल को ये जनरेट करने वाले. ग्लूकोजेनिक होता है जिसका इस्तेमाल करके ग्लूकोज को बना सकते. Purely ketogenic amino acids are what? All that list you know, no? But this question you should answer correct. Anupama, maybe you didn't get time. Now, distant vision 6 by 6, 60 by 6, 6 by 60. Yeah, that's right. Relative afferent pupillary defect, Marcus gun. Classically, if there is any optic neuritis. Once more, doctor, one pupil, Edinger-Westphal, Marcus gun, adistonic pupil. How do you differentiate? Anisocoria, everything you should read. Now, gene therapy, where will you not use? Gene therapy. Quick answer. What is the answer of our online classmates? Let us check. Yeah. It is? You have rightly thought, Anupama, at least you made me proud by saying leukemia. All the remaining we use gene therapy. Physiological blind spot. Basically because of the optic disc. Fossipukes. Beautiful. Then satellite lesions. Fungal corneal ulcer. Most important buffer system in our body is what? Bicarbonate buffer. Beautiful, beautiful, doctor. I am going to, every year from Guntur Medical College we get at least 2 to 3 in the top 10. At least top 20. So you should be quite sure. Now, which is not a feature of retinitis pigmentosa. Excellent, doctor. Disc hemorrhage. Arteriolar attenuation, bony corpuscular lesions. If you look at fundus and look at arterioles, how do they look like? Narrowed, attenuated. Classical feature of retinitis pigmentosa. That pigment will make the margin become blur. That's the idea. Phacoemulsification probe. Titanium. That's good, doctor. Carboxylation of pyruvate oxaloacetate. Doctor, you do this wrong. Biotin is carboxylation. What is important for transamination? Pyridoxine. Right? Vitamins, doctor, biochemistry mein vitamins is the top of the world. You need to be quite sure about it. Now, epiphora. आंखों में आंसू क्यों होगा? दिल टूट गए तो. What is your answer? Chronic nacreocystitis. Then LASIK, what is a contraindication? Absolute. Another very standard question. Keratoconus is an important contraindication. So I leave to you the literature of all that. Now, cardiovocal syndrome. दिल का साइज बढ़ने के वजह से रिकरेंट लेरिंजियल नर्व पैल्सी आके vocal cord में प्रॉब्लम आके dysphagia, etc. Typically in Ortner syndrome, whenever there is any mitral pathology, left atrial enlargement enlarges into the posterior mediastinum and compresses the recurrent laryngeal. Is what need to be remembered. Hills-Berger sign is what happens in acoustic neuroma, doctor? There is a anesthesia of the medial posterior superior areas of the external auditory canal is what need to be remembered. Partly cytosol, partly mitochondria. Classical question. At least we are not asking you which is a mitochondrial enzyme out of the 4 enzymes of the urea cycle. That was the expected question actually, but it said that I will not come. First let us check this year. How many students know it occurs in both of them? So, urea cycle. Carbamyl phosphate is a step in mitochondria. Right, doctor? Anterior pillar of tonsil is formed by. Check your tonsil and tell the answer correctly. What is the answer? Beautiful. Paladoglossus. Whereas posterior tonsillar pillar is by paladopharyngeus is what need to be remembered. CSF rhinorrhea. is basically by beta 2 transferrin. Unsheathed microfilaria, where do you see? Oh, great. Please give another big clap. Vanilla is our loud clap, Dr. You are too egotic. You are not agreeing. Your junior is answering correctly. Huh? Good, Vanilla. Good. Huh? So, onchocerca volvulus classically is the unsheathed microfilaria. Tripod fracture. What does it involve? It basically involves zygomatic complex, zygomatico-maxillary complex or a malar fracture, which is not an antioxidant, doctor. Lactate dehydrogenase has no antioxidant. Acute otitis media commonly due to Streptococcus or Staph aureus. I think this question require a. We'll check that. We'll check this. Mikulic's cell and Russell bodies, which is different from sporidiasis, which is fungal. Scleroma is due to Klebsiella or rhinoscleromatis. Huh? Yeah. Which? Bacterial, eh? Oh. Rhinosporidium seaberi. Oh, good, good. It's no more fungal, bacterial nowadays. That's the problem, doctor. Quickly, agar seat nahi mile to, it will also become viral. Then enterovirus is which strain, doctor? Beautiful. Serotype 70. Some numericals remembering like what is that mathematician's name? No, Raman, recent mathematician. Madam, one madam is there. Shakuntala Devi, like a mathematical wizard. You need to remember a few numbers. Type of scale. What is that in Pitria Sosia? Colorate, like a Berkeley cigarette paper. You need to be sure. Colorate scale appearance. Seborrheic dermatitis mein what is not a feature? Huh? Right. So, folliculitis, erythroderma, blepharitis. It's more common in which subset of population? Seborrheic dermatitis. It is also cradle cap in the newborns, Parkinsonism patient, retroviral patients. Seborrheic dermatitis is one of the common finding. Then this is how you find the features of seborrheic dermatitis. But next time any of your classmates has this, don't suspect HIV in them. So it's more common, does not mean it is seen definitely. Genital tract. What is not transmitted out of all this? Which is transmitted by? And example of corona is? Come on. Example of coronavirus. Common virus. अगर कोई हनीमून सिंगापुर आके खांसी आ गए तो क्या बोलते थे? उसका एपिडेमिक पैंडेमिक हो गया. SARS. Oh, your जमाने में SARS नहीं है था क्या? SARS, severe acute respiratory. आपके जमाने में है या नहीं? हमारे जमाने में था. We were in MD second year when SARS was very pandemic. Huh? Coronavirus. Now, doctor, reticular lacy white pattern, what is that called? Wickham striae. Where do you see? Lichen planus. Eclampsia doesn't include preeclampsia. Convulsions are not the part of prodromal phase. Lyme is caused by Burgdorferi. Oxytocin, what is true statement? You want to say? 3 to 4 minutes. 3 to 4 minutes. What type of peptide? How many amino acids are there? Nanopeptide. Oh, beautiful, doctor. You are ready. तलवार के तार के जैसे आप तैयार है, कुछ भी पूछे जाए, ready to crack it and shoot it. Toxigenic, ETEC, beautiful. Prenatal genetic diagnosis, what is accept? One more question. You can instantly guess in the exam hall. D. Oh, doctor. Blastomere biopsy is regularly done. Most common method of embryo biopsy. Embryo biopsy. See, doctor, for example, if you are a MD entrance topper, let us say, but you are very ugly looking MD entrance topper, then you thought, oh, I am such a brilliant, but throughout my life, everyone was commenting about my morphometric features, so you married the most handsome guy, and when pregnancy happened, you want to check, how is the embryo? Is it also going to become future topper of MD entrance and also equally handsome like the person you married? The embryology report came, blastomere biopsy. He is as ugly as you and as moron as your husband. Right, doctor? इसको बोलते हैं match fixing. So then you need to worry. So because I said. So blastomere biopsy, common method of embryo biopsy. It won't predispose. Now, infant born to diabetic mother, what is except? Learning disabilities won't be there. There are toppers in our class whose moms had been diabetic. High level disinfectant includes, which is called? The only one you know is glutaraldehyde. Better bet on that. Unknown unknowns are more dangerous than the known unknowns. Glutaraldehyde. Commonest cause of first trimester abortion? Somi or ploidy? Somi. Very good. Bishops doesn't include? You don't do any contraction of uterus. Cervical dilatation, length of cervix, station, consistency, position is what need to be remembered. India Inc. Cryptococcus neoformans. I am trying to complete all 300 questions. The main idea is since it is a recent paper. Most dangerous cardiac lesion? Agar pulmonary hypertension hai to pregnancy is contraindicated. Chromosomal complement. Oh, this is a beautiful question. Primary oocyte mein kya hoga? Already diploid or haploid? Beautiful, doctor. So, similar question can come tomorrow in the state MD entrance. Secondary spermatocyte mein kya hoga? Spermatid ka genetic chromosomal composition kya hoga? You have to be very sure. What is not called an active but a passive immunity? What you got as a heredity from the mom, the immunity against infections is all passive. A symmetrical fetal growth restriction. You need to be quite sure, doctor. You like to say? Beautiful, beautiful. Asymmetrical and symmetrical, which is more common? Asymmetrical IUGR is more common, and extrinsic factors are responsible. Fetus की वजह से नहीं, उनके surrounding आजू बाजू की वजह से. Chronic high BP, severe malnutrition, genetic mutations, Ehlers-Danlos, specific causes. Symmetrical is less common and more worrisome, and you have torch group of infections, anemia, etc., etc. Where do you see shoulder dystocia, doc? Basically in the post-dated pregnancy, which is a non-cultivable fungus. Beautiful. Rhinosporidium. Commonest cause of maternal mortality? Hemorrhage, doctor, hemorrhage. So tomorrow as an obstetrician, your best friend at tough times is the blood bank. So if you are not in good terms with them, you will lose patients. Most common form of compound presentation? Head and hand. Head and hand. Head and hand. Delayed hypersensitivity? CD4 helper. What is the anti-D? What is the protocol? 300 micrograms. Beautiful. Active management of third stage में. When will you give methyl ergometrin? Huh? That's good. I think Hassan attended labor room posting. Half the babies born in the lab. When was your recent labor room posting, doctor? Huh? Still you are strong with obstetrics? At 2008? No. Now you are house agent, no? You are in service. Huh? Oh, then you will not forget obstetrics. Because in the village where you are working, you are supposed to be ophthalmologist, come obstetrician, everything, all in one. Good. I am happy to know. Anterior shoulder. So, doctor, physiological versus active management, you need to be quite sure on the protocol. ALL, हमारा favorite question आ गया. ALL, CLL, CML, CLL. Everything, anything. And non-Hodgkin's, Hodgkin's lymphoma. So, what is your lucky number? That's right, doctor, which is unlucky number for the patient. 411, 814, poor. Low hypoploidy or near triploidy, poor. High hyperploidy is good. Deletion of 9p. All deletions are not bad. Some deletions are good. And that would be good prognosis is what need to be remembered. MTP. 20. That's good. Red degeneration common in pregnancy. Which is hypersensitivity pneumonitis? Sing along the right answer. Huh? C, you want to say byssinosis? Byssinosis? Anybody thought berylliosis? Excellent, doctor. One big clap once more. Loud clap to Vinila. Byssinosis was your answer, eh? Hurry, come on, doctor. Agree. You said berylliosis or byssinosis? Oh, that's good. That's good. That's good. So, now, doctor, streaky ovaries. Excellent. Turners. Normally, menstruating women, amenorrhea is due to, which is then called secondary amenorrhea, is due to all except Mullerian agenesis or Mullerian agenesis. That's right. It is the Mullerian agenesis. Though there is a bleeding, it can't be expressed out. Rokitansky-Kushner-Hosner syndrome. Blood index, which reflects iron deficiency. Challenging question. Your answer is PCV? MCV. MCV? That's good, doctor. MCV, in fact. CIN type 1, 2, 3. American College of Gynecologists recommendation, not your Arundel Pate recommendation. Be very sure. How do you want to manage? Lower third of epithelium. And one more question is there about management. We'll come back to that. If a woman wants future fertility, she is in cervical carcinoma stage 1. What do you want to do? Cone biopsy is one answer I heard. Radiotherapy, Hassan. But in case of early carcinoma, want future fertility. Radical tracheotomy with pelvic node dissection is the best way to manage such a case. That's an important protocol. ये बोलो डॉक्टर, मेकासर्मिन ये क्या होता है, कहाँ होता है, जल्दी बोलो. इज इंडिकेटेड. गेस मारो. अगर कभी भी नहीं सुने, पहले बार सुन रहे तो बहुत इजी. सी दैट इज कॉल्ड एज पढ़ाई का जरूरत नहीं है, ज्यादा पढ़े तो कम मार्क्स मिलेगा. इट इज कॉल्ड मेकासर्मिन, recombinant human insulin like growth factor, which is used for the growth failure. Right, doctor? Now 1B, I told no, every Sunday mock test, what is my say? Golgi tendon organs, 2 पेज होता है गैनोंग में, पढ़ना जरूर है. What is your answer? Golgi tendon organs. So, doctor, the Golgi tendon organs 1B type is what you come across, and the changes in the muscle tension are the ones which are recognized by Golgi tendon organ. What is our next favorite question we expect? REM, NREM stage 4, 1, 2, 3. You need to know. Okay. When is it decreased in? No. REM sleep. Stress makes us to grow better. All the problem of the modern parenting is we are trying our best to remove the stress from our kids, next generation. So unless stress is there, where will the growth come? Easy way to remember. Of course, if you sleep also, if you fast also, growth hormone increases. REM, no, once more NREM. There is a difference between what happens in REM and NREM. मैंने बोला ना, एक एंटी रिट्रोवायरल ड्रग मैकेनिज्म के बिना एंट्रेंस नहीं होगा. What is your answer? Maraviroc. Next entrance में comed के में maybe enfuvertide they might have asked. I don't know. We'll know tomorrow. Maraviroc is that chemokine co-receptor antagonist is what need to be remembered. This is a tough question to answer. Jaldi bolo. Spinal motor neurons में it is a chloride. If you look at the resting membrane potential, doctor, sodium's equilibrium potential is 60. It is only good for upstroke. Potassium is minus 90, chloride और कम है minus 70. Now sperms develop the capability of motility in housemanship. What is your answer? Epididymis. What is that phenomenon called? Capacitation. Recent question in our West Bengal entrance is, what is the definition of capacitation? All entrance question banks are directed towards semen, quality of semen, WHO standards of semen, spermatogenesis. That is one high yield topic you need to be sure. Sharp. Now, doctor, therapeutic use of acetylcholine is not possible. Why? Because it is rapidly degraded. After a carbohydrate insulin rich meal, what stimulates the insulin secretion? What is the answer? What is the strong stimulant? GLP-1. See, GLP-1 is the answer. So it is the one which strongly stimulates. Any inability to stimulate insulin is also responsible for diabetes. One of the pathologies implicated is pathophysiologist is GLP-1. Once more, the incretin, exenatide and all these things, diabetic drugs and mechanisms, you need to be sure. Cerebellar cortex में what is only excitatory fiber? Once more I told you, cerebellum के ऊपर दो questions आ गया. Guess recent anatomy passed out. जल्दी बोलो बेटे. Vinila, what is your answer? Guess मारो. Purkinje is Hassan's bid. और एक bid करो. See, granule cells is another bid. Then what is your answer, Anupama? Purkinje only. Come on, any other answer, doctor? Some guess? Who said granule? Who said granule? Give one big clap. Good. Excellent, doctor. You are giving me a sumptuous academic dinner for having had come to Guntur all the way. Granule cells use glutamate as their neurotransmitter and they are excitatory. Harshprum. Easiest question. Then sodium channels are highest where? Node of Ranvier. What is the, this is a dirty question. P50 ka oxidation curve right to left to सब कुछ पढ़ा, but suddenly examiner want to know at what value of PO2 is the P50 happening. Guess मारो Vinila, आपका answer क्या है बेटा? Quick answer, guess. Huh? B 27. That's good. 27 is the point of PO2 at which 50% hemoglobin got saturated. Doctor, easiest question in the world. Cerebra thevesia. What is it? Carabin. That's what Solanaceae may. Solane will be there. Huh? So Liliaceae may, Lily will be there. Huh? So Thevetin. In fact, it is also called yellow oleander and it is a cardiotoxic plant. Ejection fraction is a ratio of stroke by and diastolic volume. Railway spine is also known as, what do you mean by railway spine? Come on, give a guesswork. Hassan, bolo bete, what is your guesswork? Railway spine? Huh? Contusion. Or any other answer? What is that? Fracture of spine. Huh? Oh, what else? Concussion of spine is the railway fracture. Patients will have ataxia, etc., etc. Doctor, which is involved in color vision. Visual cortex, which lobe itself is a big deal. On the top of it, what is the Broadbent's mapping? Below. Come on, guess without looking key. Area V8 of the visual cortex. Our color vision is there. So, doctor, thanks for a patient listening. Since you are about to go for the exam, I could take courage and liberty to revive all 300 questions. But it is an anti-human endeavor to torture students so long. So, thanks for the patient attendance and we wish to see you all big way. And there is only one way, that is called the winning the APPG into the top 10 ranks, right? Thank you. Last question.